Hello dear friends, hello dear audience, dear YouTube family. I hope you all will be fine and doing well. Dear YouTube family, in the today topic I will discuss the procedure of contact precautions. All the steps that are involved in the standard precautions along with gloves, gowns and placement. But before starting my video, I kindly request you to please subscribe to my YouTube channel Naeem Videos. So our today topic is procedure for contact precautions. So the first one in the on strip is in standard precautions along with gloves. So gloves should be worn when entering the room. The second one is gowns. A gown should be worn for contact with the patient and with the patient items. A placement, the patient should be placed in a separate isolation room. If a separate room is not possible, the patient may be placed in a room with another patient with an identical infection condition, which is called cohorting. Appropriate signage to be placed outside the room. Limit the number of visitors as appropriate, and family or caregivers should be educated on contact precautions and hand hygiene. In the procedure of contact precaution, the fourth step is the transport. So activities of the patient may need to be limited, and when transportation is required, the following measures should be undertaken. Patient's body is contained or covered. Avoid contact with objects, and if necessary, use gloves and maintain hand hygiene. In the procedure of contact precaution, the fifth step is patient care equipment. Use of dedicated patient care equipment should be considered where possible. For example, stethoscope. Where this is not possible, items should be disinfected after each use. In the procedure of contact precautions, environmental measures, the sixth step is environmental measures. So there are also two further sub steps in the environmental measures. So in environmental measures, the first A step is focus on room cleaning and disinfection. That is, for example, daily bed rails, over bed tables, bedside commode, lavatory surfaces in patient bathrooms, doorknobs and equipment in the immediate vicinity of the patient. Housekeeping services need to be done at the end, and then change the mops, dusters and solutions. Contact precautions everyone must follow. Everyone must clean their hands, including before entering and when leaving the room. Providers and staff must also follow contact precautions of put on gloves before room entry, discard gloves before room exit, put on gown before room entry, and discard gown after before room exit. Do not wear the same gown and gloves for the care of more than one person. Use dedicated or disposable equipment. Clean and disinfect reusable equipment before use it on another person. Infection which requires contact precautions are medications resistant diseases like MRSA, methicillin resistant Staphylococcus aureus, VRE, vancomycin resistant enterococci, C. difficile, Clostridium difficile, ESBL, extended spectrum beta lactamase providing enzyme inhibitors, MDR, multi-drug resistant strains, scabies, norovirus, rotavirus and hepatitis A. So this is all about the contact precautions. Our next topic will be droplet precautions. So droplet precaution is basically occurs when droplets containing microorganisms generated from the infected person, primarily during coughing, sneezing, or talking, or during procedures which generates secretion like suctioning, bronchoscopy, etc., or propelled a short distance less than 3 meters and deposited on the susceptible host eyes, nose, and mouth. These droplets are relatively large and do not remain suspended in the air. Therefore, negative pressure rooms are not necessary. Recommendation for droplet precautions include: place the patient in a single room, wash hands thoroughly before entering and after exiting the room, put on an isolation mask before entering the patient room. Patients may not leave the room except for essential tests or procedure that cannot be performed in the isolation room. The patient should wear an isolation mask when out of the room. Infections that require droplet precautions are influenza, pertussis, which is also called whooping cough, mumps, diphtheria, German measles, streptococcal pharyngitis, meningitis, and pneumonia, and respiratory illness such as those caused by coronavirus infection. Standard best precautions are we should follow. Standard precaution: droplet plus contact isolation. We should clean hands, gown, we should wear gown, we should put mask plus eye protection and gloves. This was for today video. I hope you will like my video. Please do subscribe my YouTube channel, Naeem Videos.